Microcirculation, a very fancy word, which simply means very tiny blood vessels. More specifically, blood flow through very tiny blood vessels. Our body depends on these very tiny blood vessels to get oxygen, nutrients, and other important chemical compounds to the cells of our tissue so that our body functions normally. With abnormal microcirculation, you have an abnormal functioning body. We have a patient who had microcirculation problems, and we're going to talk about how we address this in the next segment. Welcome back to Montgomery Heart and Wellness, and we have another exciting clinical rounds with you. Camille and I was just talking a few minutes ago, and she was telling about a patient she took care of who had a chief complaint of cold and crampy feet. It's a 53-year-old lady, right?
Yes.
Can you tell us about this?
Yes. So she'd been dealing with the coldness of the extremities for at least over a year, and the cramping more recently was getting worse. And she typically ate healthier than a lot of people. She ate mostly plant-based, but would kind of go in cycles where she'd add back fish or seafood into her diet. That had kind of been going on around that time. And she had a very busy job. She didn't get to exercise a lot. But these symptoms were severe enough that she was very concerned. She came back in and we did a full workup. Mm-hmm. Her other medical history included high cholesterol, some impaired filling or impaired relaxation of the heart, some iron deficiency as well. And so we had recommended that she go back on an all plant-based diet, mostly raw. And she did all raw for a little over a month, almost 2. And she stuck with intermittent fasting. She had always done that. And then we really added things she hadn't done before, like the infrared sauna therapy.
With the cold and crampy feet, what was your initial thought with this patient?
Yeah, so my main concern was peripheral vascular disease. So poor circulation in the arteries that supply oxygen and nutrients to the legs and the feet.
People think about circulation problems. They think about blockages. As doctor, do I have any blockages? We'll often do procedures called angiograms, where we inject contrast through a catheter in an artery or a set of arteries, and we'll look to see if the contrast gets stopped due to an occlusion or pinched off or narrowed. And oftentimes we don't see narrowing these large vessels. But the vessels that we see on an angiogram, whether it's an angiogram of the heart or an angiogram of the legs or an angiogram of the brain, these are the large vessels. The vessels we cannot see are the microscopic vessels. So many individuals will come and say, well, doc, I had a heart cath, a coronary angiogram, I had an angiogram of the legs, and they said everything looks fine, but I'm still having symptoms. That's because you may have microcirculation disease, or we often call it small vessel disease. And these are the vessels you can't see. And there are different ways you can test for these abnormalities. They're not all very specific, and she did have some specific tests. They gave a clue that she had microvascular disease, and you're going to talk about those. So I just want you to understand that she had symptoms, and we immediately attribute those symptoms to circulation problems. But she had strong pulses, and the ultrasound showed the large vessels to look normal and unobstructed. But we strongly suspected that she had disease on the tiny vessels.
So in addition to the therapeutic approach of the raw detox and intermittent fasting, we also implemented the infrared sauna. So infrared sauna is like a dry sauna that utilizes infrared light, which is of a particular wavelength, which allows it to penetrate deeper in the tissues and stimulate the release of nitric oxide. That's a main mediator of vasodilation, so helping those blood vessels open up, improve the delivery of oxygen and nutrients to tissues. So she did the Doppler studies initially and the ABI. So a Doppler study is an ultrasound of the arteries in the legs, and we look at the flow across the different arteries. So triphasic flow is great, that's the ideal. And the distal arteries in the lower part of her legs and going to the feet, she had biphasic flow, which is mildly reduced blood flow.
That's monophasic, biphasic, and triphasic. Now these are basically, medical jargons, but mono's 1, bi's 2, tri's 3. When a blood vessel has normal flexibility and a wave of blood flow goes through it, it goes. That's 3, and you'll see the Doppler shows 3 waveforms. It's up, initial, then down, and then back up. So that's a triphasic. That's a normal or normally compliant or non-stiff blood vessel. If it has that's biphasic, it's mildly stiff. And if it's monophasic, it's very stiff. So she had triphasic except for the very tiny branch at the lower is only biphasic.
Correct.
And sometimes biphasic waveform could be a sign of stiffness of blood vessels distal, meaning those microvascular blood vessels are abnormal. Okay? So the blood vessels get stiff early on before you get blockage.
Correct. And we also did the ankle-brachial index, which is another way to check blood flow, where we put cuffs on the ankles and the wrists to compare the systolic pressures. And so on the initial ankle-brachial, or the ABI index that we tested, her scores were actually a little bit elevated above 1, like 1.2 to 1.35. A good score is 1. And generally, the lower the score signifies worse artery disease, but a higher score can indicate more stiffness of the arteries. So those small vessels too, they're not opening appropriately.
Again, the ratio of the upper and lower blood pressure should be roughly 1-to-1. If it's lower flow in the blood pressure, that's impaired flow, then it's going to be less than 1. If there's stiffness in those arteries, then it's going to be greater than 1. So she had stiffness in those arteries in the lower extremity, so it's greater than 1. So this was a baseline finding. Cold, crampy feet and what appeared to be stiff arteries. She was on an almost plant-based diet, eating some fish.
So we did the infrared sauna that we talked about, and she would come 4-5 days a week for about, almost 2 months. The other main therapy was the beamer therapy. So beamer therapy stands for bioelectromagnetic regulation. So that type of energy therapy, it delivers a pulse electromagnetic frequency to the body through a mat that you lay on, and that helps improve blood flow in the small blood vessels like the capillary beds. And that's where the exchange of oxygen and nutrients and removal of waste occurs, so that's really important.
So essentially, we worked on the circulation with diet. She went 100% plant-based, got rid of the fish, did the sauna, and did the beamer. And this was about for 3 months, and what happened?
Yeah,
what happened with her results?
So her results showed really great improvement. So on the arterial Doppler, the lower extremity arterial Doppler, which is that ultrasound, where those more distal vessels, it showed biphasic flow, that actually improved and went back to triphasic flow. We did another ankle-brachial index, and on each leg that normalized. So instead of being high around 1.3, I went down to 1 or 1.09 normal, and that definitely correlated with her symptoms too, because and her physical exam findings. So she wasn't having the leg cramps anymore, and on physical exam the temperature of her legs and feet was normal. Before, it was markedly colder. I definitely remember that.
Yeah. So again, improvement on the clinical side, The objective findings were there, and diet, Beamer, infrared sauna were the key. Her inflammation also decreased as well.
Yes, so her inflammation, one way we check that is a blood test called the HSCRP, or high sensitivity C-reactive protein. And a high level of inflammation is really anything above 3, but a low level of inflammation would be less than 1. So her initial score was 7.5, so very high. And we rechecked it. It was about 2.5 months, maybe 3 at this point, and it went down to 0.3, which was amazing. So a huge drop in inflammation, which was related to all the aspects of her therapy. So the raw detoxing, the intermittent fasting, the infrared sauna, and the Beamer. And she was feeling much better. So her symptoms also lined up with her testing showing less inflammation as well.
What I want you to take home from this is that disease starts at levels where we can't see on a lot of our tests. We have to look at a number of different things, like, of course, symptoms, inflammation, inflammatory markers. This patient improved in all these categories, and Camille did an excellent job by looking very carefully at very specific tests that gave clues as to the microcirculation being abnormal. And so this is really important, and it's important to understand this because we caught this disease early on. Had it persisted, it could have gotten worse to the point where she could have started having large vessel disease and then started having some risk of compromise to tissues. This is the first phase of a long-standing situation where people end up getting amputations and the like. So keep this in mind, microcirculation. So I hope you got a lot out of this, and as always, until the next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.